Welcome back to our Bluesy Water channel. I just wanted to briefly discuss ear ozone insufflation, a bit of an insight. First of all, ozone is one of the most profound therapies for going after microbes. And when you do it strategically, you can address various areas in the body. So, for instance, rectal insufflation ozone. When you buy a home system, goes blood systemic, and it also treats the large intestine. This is very, very important because most of our disease starts in a toxic colon, and that breeds all kinds of pathogens. And so when we clean the colon deeply with ozone, we can start to work at very long-term uh, things like candida, things that have just housed in the body. Now, the second nest in the body is the sinus cavity. So when you do nasal insufflation ozone, you can really take 20 years of chronic sinus infections, knock it out in a short period of time. Today, I want to talk about ear insufflation. Something I learned about ear insufflation, which is worth sharing. First of all, the purpose of doing ear insufflation ozone, obviously, is if you have an ear infection, also to treat the brain. It gets into the microcirculation and help with the brain. Now, this is not inner ear. We have a technique for the inner ear, which we'll post a link below, treating the inner ear. You can't do that through sinus, and you can't do that through an outer ear application. So the inner ear is a simple trick to route the ozone up the eustachian tube to the inner ear. We have several videos, and I'll post some links to that. And also just look at our ozone playlist, and you can just search our channel for inner ear. Now, the outer ear, this is the thing I learned. It's hard to determine sometimes if you're having a problem, if it's inner ear, outer ear, sinuses. It's that they're all kind of compacted in the same region. So recently, I thought I was having a issue because I flew and I came back, and my hearing was starting to get challenged. But I also did get sick, and it turns out in this case, previously I had an inner ear issue. This case was actually left outer ear. So I went to the ear doctor, and she said I actually had a fungal infection. She also said, and this is why I want to do this video, I had a bunch of wax. So I'm thinking to myself, God, how can I have a fungal infection? Because I do a lot of ear ozone insufflation. So this is kind of my guess as to what happened. I think I started building up a bunch of wax, and the moisture will help cultivate a fungus. So a fungus was cultivating under the wax, but when I went to treat with the ozone, the wax acted as a barrier. So essentially, actually the wax, if you do, and this is another important point which I want to make, if you do the ear ozone, it's almost like a clay in a kiln, because it's very drying and it's kind of very warming. So if you have moist wax in there, probably what happened is the ozone kind of hardened the wax, created a sealed environment, and the fungus was growing underneath that. Now, it's very simple. This is the reason I'm doing this video, is I want to point out an easy way to approach this. Number one, realize that if you do have wax, you do not want to harden it. So you want to make sure you are treating the wax. You want to have an open ear canal. If you have an open ear canal and something was growing in there, that ozone will knock it out quick. But if it's sealed, you can have a problem. Okay, so how do you figure out what's going on? Well, number one, good suggestion. It cost me $30 copay to go to the ear doctor, and I got a thorough understanding of the situation. She gave me some fungal ear drops. She took out the wax, and within a few days, I was fine. But if you want to get a little more self-involved, self-position, heal thyself, I'm pulling out here a simple otoscope. You can buy these on Amazon. They're very cheap. It's a little protective cover. And this actually has a camera in here. When you put it in your ear, you see your whole ear. And you can look online for a bunch of videos where people are doing this. But you can for sure see down into the eardrum. It comes with all kinds of attachments. Okay, so it comes with a little attachment. Now it does have other attachments where you could try to take out wax. I'm using this mainly to examine. So the right ear had a little wax. The left ear is perfectly clear now. And I mean, the right ear is quite open, so I could do ozone if I chose to in the right ear, and it would go all the way down to the eardrum level. Same thing with the left ear, totally clear now, and I don't feel any symptoms. And guess what? I can hear. Being totally plugged up with wax is very, very frustrating. It can affect your mind. It's like you're half deaf, basically. So I would use this to examine the ear. Now, let's say you did have a bunch of wax. There are products, one's called Debrox, or products like that, that essentially it goes in the ear and it kind of loosens up the wax. And then after 4 days, you can kind of rinse it out. Or you could go to your ear doctor and have them clean out your ears. Some people talk about ear cannling. I don't know if that works or not, but at the end of the day, whatever you do, you can examine your ear and say, okay, this is where we're at. Now, if you do have a bunch of wax, get it cleaned out and then proceed to do the ear ozone. But remember, ozone won't go through hardened wax. It'll just block it out. So that's why I got a fungal infection. So I would recommend for sure going to professional, buying this and examining your own ears. Then you can make various decisions like, oh, I'll get rid of the wax. Now, if you're going to do ear ozone, I also recommend a few drops of olive oil after the treatment, because it is a very drying therapy. It's similar to when you're doing vaginal ozone insufflation, even rectal ozone insufflation can affect the mucosal lining. So we want to try to kind of soothe the ear with a little bit of olive oil. Also, olive oil does help loosen earwax. So you can play with various options, but it's good to see what's going on. Now, if you have a lot of wax, I go to a professional and get it removed. And or you could try doing it your own. This tool does come with these little scoopers. I haven't really tried to do that. So my strategy is to use the Debrox, see if I can soften the wax, or I'm going back to my ear doctor for a recheck, and I'll probably ask her to look at my right ear. And you see, now I go in and I can even show her the video of my right ear and say, hey, what do you think? She might say, it's not that much wax. She might say, it's fine, you don't need to do anything. So just keep in mind that the ozone can harden wax, so you do not want to block your ear cavity. So just stay in tune with what's going on using this scope. All right, I appreciate it. Any questions, contact me, Andrew at blueseawater.com. Thank you.